Good evening, everyone. Welcome to today's live session where we'll be delving into a crucial topic, environmental pollution and cardiovascular health. I'm your host, Maitri, and joining us is Dr. Khanna, an expert in cardiology. Welcome, Dr. Narendra.
Hello Maitri and viewers. Today we are going to talk about a very interesting topic and very pertinent to today's times, which is environmental pollution and cardiovascular health.
Let's get started. Dr. Narendra, how does air pollution affect the cardiovascular system, and what are the potential risks to heart health?
Okay, so air pollution actually contributes to more than 30 lakh deaths every year because of cardiovascular problems. And this is going to increase further on if proper initiatives are not taken at individual level and at the national and international level. It's very disheartening to learn that 3 million people die of heart attack because of air pollution directly, apart from other risk factors. And it is seen 9 out of 10 people all over the world actually do not breathe natural and clean air. 9 out of 10 people in the world breathe polluted air, and 20% of the people in the world actually die of cardiovascular disease because of air pollution.
Thank you for explaining this, Dr. Narendra. Are there specific pollutants in the air that pose a greater risk to heart health, and how do they impact the cardiovascular system?
Okay, so in environmental pollution, we have 2 types of pollutants, which could be particulate and non-particulate matters. The non-particulate pollutants are sulfur dioxide, carbon monoxide, and carbon dioxide. But the pollutants which are of particulate nature, they are the main pollutants which actually cause cardiovascular disease. And they are classified into 3 types depending on the size. PM10 is any size of pollutant which varies from 2.5, which is greater than 2.5 microns, and up to 10 microns. This is known as PM10. The more common one and the most lethal one is PM2.5, which you normally see in the advertisements and daily news. This is of a particulate size which is from 2.5 to 1 micron. That means from 1 to 2.5 micron, this is the most dangerous variety. And then we have PM1, which is a particulate size less than 1 micron. Now what happens is PM2.5, these are small particles which go deep through the respiration, deep into the lungs. They cause cardiovascular disease and respiratory disease, and these particles are directly enter into the bloodstream and then affect heart, lung as well as brain tissues and cause stroke, cardiovascular issues as well as respiratory issues.
Dr. Narendra, how do people with pre-existing heart conditions, such as hypertension or coronary artery disease, fare in areas with high levels of air pollution?
Now, people who are living in areas which have high level of air pollution, especially India during these times, and Southeast Asia and China. Now these people have effects of air pollution both in acute setting, that means short term, as well as long term. If healthy people are exposed to long term polluted air, it leads to higher incidence of cardiovascular death and accelerated atherosclerosis. While people who already have heart disease, or pre-existing heart disease or atherosclerosis, these patients fare the worst because they are at the highest risk of having acute coronary syndromes, especially heart attacks, and also acute strokes because of air pollutions. So if you look at this, during these times, we are having sort of a period where you have high polluted air during the winter times in and around Delhi and North India. And what happens is all of us are seeing a high incidence of patients getting admitted with strokes and heart attacks, and that is why it becomes a very important, environmental emergency to actually decrease the level of pollution, and also at an individual level to decrease the exposure to this polluted air by various mechanisms, whether could it be putting on the mask, or it could also be cleaning the air by indoor air purifiers.
Thank you for that insightful explanation, Dr. Narendra. Can you elaborate on the connection between long-term exposure to air pollution and the development of chronic cardiovascular diseases?
Yes, so it's interesting. There have been many studies, and the most important study is by the University of Washington, which is a 10-year long study, and this study is known as the MESA Air Study, which is multi-ethnic study of atherosclerosis and air pollution. And this directly actually attributed air pollution to increased risk of cardiovascular deaths, strokes, as well as accelerated atherosclerosis in people who are living in these areas where the environmental pollution was high, especially the PM 2.5. What we are seeing today, like today's air quality index in Delhi is 446 and going up to 500. This classifies as one of the most dangerous levels of air pollution or environmental pollution. So if you have these high levels of poor quality of air, especially if you have an AQI more than 200, the risk of environmental health related cardiovascular issues are much higher. And if you have it more than 300, it is actually a very dangerous quality of air to actually go around and work in this environment.
Thank you, Dr. Narendra, for explaining the connection between long-term exposure to air pollution and the development of chronic cardiovascular diseases. Doctor, how can individuals protect their heart health in areas with high levels of air pollution? Are there specific precautions they can take?
Yes, so now we are into a situation where you have high level of air pollution, very poor quality of air. So we have to take actions both at individual level and at the community level and also at the global level. Now at an individual level, what is very important, if you have patients who have cardiovascular disease or patients who are old, these are the patients who are most susceptible to develop cardiovascular complications like heart attacks and stroke. And these patients should remain indoor, should not go out during morning walks or do heavy aerobic exercises in open air, because they are going to inhale much more of this polluted air, and this will directly affect the heart as well as the brain and respiratory system. At the individual level, what people can do is to wear on good masks, especially the N95 masks or respirators are very good if you are going out. And if you are at home, it is better to purify the air by good air purifiers at home. This is almost become an essential tool to keep in the indoor settings, especially in houses, to clean the air within the house. And also we should make sure that we do not allow a lot of fresh air, especially if it is polluted, to get into the homes. We should clean the air and let these older people and high-risk individuals to breathe in better air and purified air. Now at a community level, in the cities, it is important that we reduce the amount of vehicular pollution. We reduce the burning of fuel and also the burning of biofuels and agriculture products. We reduce the construction activities during these periods, and if possible, we can also induce artificial rains or sprinkle water over the highly polluted areas so that the dust particles can actually settle down and the air quality can improve. And at a global level, it is very important to actually collaborate and make policies which will prevent the burning of biofuels and bioagriculture products, which will prevent the pollution, air pollution by toxic industrial chemicals. And also there should be a global initiative for cleaner air and environmental protection, which should be a goal for all the nations. As we are going towards working towards global warming, we should also work at an international level towards better air and cleaner air.
Dr. Narendra, what role can public health initiatives and policies play in addressing the impact of air pollution on heart health?
Yeah, so that is precisely what I was talking about. So at a global level and at the government level, we have to go ahead and make these sort of laws and legislations, and actually not only make these sort of legislation but make sure that these are implemented. Recently, we had a Supreme Court ban on use of crackers during Diwali, but all of us saw that they were rampantly used in spite of the Supreme Court's decision and ban on burning crackers. and then we saw the next day the air quality actually became quite bad, and we could see that in the in the people who are getting affected, and increase in the hospital admissions because of respiratory issues and acute cardiac issues. Secondly, at a global level, there are a lot of initiatives which are being taken across the continents and between different nations. And the most important one is the Breathe Life initiative by World Health Organization, also the United Nations Environmental Program on Cleaner Air, and also we are now working towards Global Health Initiative for Better Air. This is in parallel to the initiatives for global warming.
That's insightful, Dr. Narendra. Doctor, are there specific populations, such as the elderly or those with existing heart conditions, who are more susceptible to the adverse effects of air pollution on the heart?
Yeah, that's what I told. The elderly people are very susceptible. They have to be very well protected. They are at an increased risk of acute exacerbation of or deterioration of acute atherosclerosis and development of heart attacks. They also are at a risk of development of strokes and acute respiratory distress. Similarly, patients who have pre-existing heart disease, or patients who have pre-existing lung disease, or patients who have malignancies or uncontrolled diabetes, again these patients are at a very high risk of developing cardiovascular deterioration because of sudden increase in the pollution in the air, or sudden increase in the AQI of the air, which predicts poor quality of air and high pollution.
Doctor, can you share any ongoing research or advancements in understanding the link between air pollution and heart health?
Yeah, definitely. That's what I told. There are a lot of work going on all over the world. It is now air pollution, both ambient, that is within the house, and outside, and environmental air pollution are now considered as a high risk factor for development of cardiovascular disease or deterioration of cardiovascular health. There have been two major studies which have been published and which have established a direct role of air pollution and cardiovascular disease. And the first study which I told was a study, a 10-year long study by University of Washington, which is known as the MISA Air Study, which directly linked air pollution to cardiovascular disease and also to strokes. And the second one is the one which is published in Lancet, and this is also a study which is very well quoted. It is a seminal sort of publication, and this clearly showed that cardiovascular health is directly affected by very poor quality of air, especially at the environmental level.
Thank you for that insightful explanation, Dr. Narendra. How can communities come together to address the issue of air pollution and its impact on heart health? Are there grassroots initiatives that can make a difference?
Yeah, that's what I said. One, the communities have to come together at a community level, at a national level, and at international level. This will come in by first understanding the problem and educating the public and about the ill health of air pollution, how it can be prevented at an individual level and at a level of the cities and at community, and at a global and national level. When people understand investing on cleaner air and investing on preventing environmental pollution can actually lead to sudden decrease or a massive decrease in cardiovascular death, and this can directly this directly reflects in increased productivity of younger generation and older generation, and also it has a good cost-benefit effect at the global and at the national level.
Thank you, Dr. Narendra, for shedding light on the critical connection between air pollution and heart health. We hope this discussion inspires everyone to take proactive steps towards cleaner air and healthier hearts. Any last message for our viewers?
Thank you very much for inviting me here. And my message is, don't leave. Environmental pollution is, every individual has to contribute to prevent environmental pollution. Don't leave it only to the government or the policy makers. Start at your house to decrease the environmental pollution. It could be from your kitchen. It could be from from your air conditioners. It could be driving in more vehicles instead of restricting the vehicular movement, or it could be just non-use of air purifiers at home. So you have to start thinking at individual level, and then start living at believing in the community level, how you can contribute to reducing the environmental pollution at the community level. There should be an advocacy and education to actually educate younger and older people and policymakers how to reduce this. And this should be also worked at the political level. This should be one of the major determinants and points, like in US and other places. This should be a point or a consideration during the political rallies and election, and it should be one of the determinants for parties to win, as it impacts the people's life. And like people talk about health issues, and they make political agenda and manifesto on poverty, eliminating poverty, education. They should also have this in agenda, that the environmental pollution and better, cleaner air is one of their political agenda, and they should be in their manifesto.
Thank you to our viewers for joining us in this informative session. Your heart health matters, and knowledge is a powerful tool in maintaining it. We'll be back with more enlightening sessions in the future. Until then, take care of your hearts and stay well. Goodbye.